Today in this lecture, we will talk about the pressure natriuresis and pressure diuresis. The pressure natriuresis and pressure diuresis simply means the increase in secretion of sodium and water, increase in excretion of urinary excretion of sodium and water due to increase in arterial pressure. So far, we have discussed in detail the physical forces present in the peritubular capillaries and the renal interstitium. Physical forces like hydrostatic pressure, renal interstitial hydrostatic pressure, peritubular capillary hydrostatic pressure, similarly colloid osmotic pressure in the renal interstitium and colloid osmotic pressure in the peritubular capillaries. These forces we have discussed in detail, but we will now see that how changes brought in these pressures will have effect in the reabsorption of water and sodium. So whenever renal mean arterial pressure increases, for example, mean arterial pressure increases, it will have three effects. It will have three effects due to which the excretion of sodium from the kidney will increase. Similarly, the excretion of water from the kidney will increase. So this is a typical nephron. Here we have the blood vessels coming in, and here we have the peritubular capillaries in which the fluid are reabsorbed. So when the mean arterial pressure increases, normally increase in mean arterial pressure will not increase GFR that much. The glomerular filtration rate normally will not increase that much, even with a very big increase. Even if the mean arterial pressure increases from 70 to around 170, there will be still very little change in the glomerular filtration rate. But despite of these factors, despite of this autoregulation, there is still a very small increase in the glomerular filtration rate, and that small increase in glomerular filtration rate will increase. That small increase in GFR will contribute to the increased amount of sodium and water delivered to these tubule, and ultimately increase amount of sodium and water being excreted in urine, and that contributes to pressure natriuresis and pressure diuresis. This is one effect, the increase in GFR due to increase in arterial pressure. So we are studying the concept of pressure natriuresis and diuresis, which simply is the correlation of increase in arterial pressure to the increase in excretion of sodium and water. So increase in GFR is one way through which the increase in excretion of sodium and water occurs. The second thing is whenever the arterial pressure increases, the reabsorption of water and sodium decreases because pressure increases here. In the peritubular capillaries, the pressure increases, which ultimately increases the pressure in the renal interstitium. We have discussed in detail in our previous lectures that this pressure gets transferred from the peritubular capillaries into the renal interstitium. So when the renal interstitial hydrostatic pressure increases, for example, then it is very difficult for the water and sodium to be reabsorbed from the tubules into the renal interstitium. So the excretion of sodium and water increases. So this is the second way. One was the increase in GFR. A lot of sodium and water has started entering the tubule, and on top of that, due to increase in pressure here, there is very difficult. The reabsorption of sodium and water is now difficult, and less of sodium and water being reabsorbed here. So more of that is excreted. That also contributes to pressure natriuresis and pressure diuresis. Now, ultimately, the third factor, the third way through which the increase in arterial pressure will increase the excretion of sodium and water is that increase in arterial pressure here, increase in arterial pressure in the mean arterial pressure will decrease. It will decrease angiotensin 2. It will decrease the formation of angiotensin 2. Now, angiotensin 2 is responsible for formation of aldosterone. Now, when aldosterone formation is decreased, aldosterone is responsible for reabsorption of sodium and water from tubules into the renal interstitium. When the formation of aldosterone has decreased due to decrease in angiotensin 2 formation, the reabsorption of water and salt has decreased from the renal tubule, from the nephron tubule into the renal interstitium and into the peritubular capillaries. So when the reabsorption has decreased, the excretion increases, and that contributes to pressure natriuresis and pressure diuresis. So to summarize the lecture, increase in arterial pressure leads to increase in excretion of sodium and water, that is the pressure natriuresis and pressure diuresis. But the three factors which contributes to this process include the increase in GFR Due to mean increase in arterial pressure, there is increase in GFR. There is increase in the hydrostatic pressure in the renal interstitium, which leads to decreased reabsorption. And similarly, there is decreased formation of aldosterone, which also leads to decreased reabsorption of sodium and water. So that's all about the pressure natriuresis and diuresis. Thanks a lot for watching the video.